Good morning. We are allowing time for a few more participants to join in with us. So bear with us just for a few moments, please. Good morning, everyone. I am Bernadette Darns Jackson. I'm a proud member of the Greater Metropolitan Detroit chapter of Sisters Network. This morning we have with us Ms. Grace Ann Fasaye. Grace Ann Fasaye is a board-certified genetic counselor at the National Cancer Institute who serves as an associate investigator on numerous studies within the Center for Cancer Research. She provides genetic counseling to patients enrolled on surveillance and therapeutic protocols for cancers of the breast, ovaries, stomach, prostate, and lung. She is a member of the Global Genetics and Genomics community, which develops online simulated case studies for use by students and practicing providers. Throughout her 20-year career, and she only looks 20, she has been committed to training the next generation of clinical genetic providers, mentoring genetic counselors for underrepresented backgrounds, and educating the community about genomics at health events. Grace Ann received her master's degree from the joint Johns Hopkins School of Public Health and National Institute of Health. Grace Ann, I will turn it over to you now.
Thank you so much for that introduction. Good morning, everyone. I'm very excited to be here today for this National Town Hall as we discuss the crisis, the breast cancer crisis in Black women. I was able to talk last year at a Sisters Network event during Breast Cancer Awareness Month. And I'm just I feel very fortunate that I was invited back to speak. And most importantly, I feel honored to be able to talk to you all and share the knowledge that I've gained during my career about breast cancer and genetic testing for breast cancer. So let's get started. I am going to share my screen, so bear with me for a second. Can you see my screen?
Yes, we can.
Okay, and you can hear me okay too?
Yes, you're coming through fine.
Okay, let's get started then. Oops. All righty. All righty. So I'm going to be discussing why genes matter and the importance of knowing your family history. Some of these, the importance of knowing your family history came up earlier in the talk with Dr. Newman and Dr. Mitchell, and I'm just going to expand on that a bit, particularly highlighting why Black genes matter. So just a quick housekeeping disclosure statement. I'm going to be talking about a couple of genetic testing labs just so that you're in the know about different types of resources that these testing labs offer, such as no-cost testing, but I have no financial interest in any of these companies. Also, I'm a federal employee, so that means that any views or opinions presented are just mine, they're my own, and they do not necessarily reflect those of the National Cancer Institute or the National Institutes of Health. But for the most part, I'm gonna stick to the facts. So an overview is that I'm gonna briefly go over the breast cancer risk factors, specifically family history as a risk factor, because that's a major one, and the importance of knowing your risk factors so that you know your risk level. We'll discuss genetic testing, what that is, and the benefits and implications of genetic testing. And we talked this morning about those striking numbers in the breast cancer crisis in Black women. there's actually also a crisis in genetic healthcare for Black women. So we're going to talk about the connection between those two. And then we're going to have a call to action. How can we put our efforts together to make change, to close some of these gaps and disparities? So here is a list of breast cancer risk factors. I'm not going to go through all of them for the sake of time, and I'm sure most of you have heard these. But up front, I want to address the women on the call who have never been diagnosed with breast cancer. You're a caregiver, you're supporting your relative with breast cancer, because I know it came up earlier, for your daughters, you've been diagnosed with breast cancer and you're concerned about your daughter's risk for getting breast cancer or your sister's risk. So there are breast cancer risk models that can be calculated to give someone an understanding of their lifetime risk to develop breast cancer. And this is so important because even though I'm gonna talk a lot about genetic testing, it only provides the answer as to why breast cancer is running in the family about 5 to 10% of the time. But for other women who have a family history, they can still find out their risk to develop breast cancer. There's a tool that takes into account all of these factors, including family history. And the link is going to be dropped in the chat because you can do this if you're an unaffected woman, you've never had breast cancer and you're 35 years or older. You can run this model on yourself. It's free, it's online, and then take it to your doctor, take it to your nurse practitioner, a trusted provider to discuss your risk for breast cancer and what you can be doing about it. So major breast cancer risk factors, we talked, the last slide talked about risk factors that can slightly elevate the risk, but these are the ones that are associated with increasing the risk the most. Being a woman, being born a woman, gender is a risk factor for breast cancer. Men can get breast cancer too, but the risk is much lower. So being a woman is associated with highest risk. We know breast cancer, along with most cancers, are considered a disease of aging. So over time, as you get older, women become more at risk for breast cancer. If you have a personal history, so you've already been diagnosed with breast cancer and your surgical treatment was a lumpectomy or a mastectomy on one side, if you still have breast tissue, then you have a somewhat higher risk to develop another breast cancer. Family history, so having a mother, a sister, a daughter with breast cancer can make your risk higher, in addition to having other relatives like an aunt or a grandmother. And then we're going to talk about genetic susceptibility, which is a little bit different than family history. People with a family history can have a genetic susceptibility, but like I mentioned, not always. We always can't find something. But about 5 to 10% of the time, if a woman undergoes genetic testing, or by examining her history, we may be able to tell that they likely, or do, if the testing confirms it, have a genetic factor. So one gene, a gene that we all have, but there's a variation in the sequence, the code of the gene, the chemical code, that's putting that woman at risk to develop breast cancer, or may explain why she did develop breast cancer. So genetic testing involves a blood sample or saliva sample. Some of you on this call may have already had genetic testing in the past, but we're going to talk a little bit more about the implications, because if someone tests positive for a gene mutation, it then impacts relatives. Children can be tested. They have a 50% risk to have the genetic risk factor, as well as siblings. And that information is what they can use. They're armed with this information. If they test positive also, and they don't have cancer, what can they do to reduce their chances of cancer, such as screening, like mammograms and breast MRIs more frequently, or reducing their risk with surgery. And so I know we often talk about family history of breast cancer, and we tend to focus on that. But we know that there's several different types of cancer that can go along with breast cancer. So if you are collecting and asking about your family history, or you're providing that information to your doctor or your any other healthcare provider, don't just focus on breast cancer. Of course, you want to provide that. But we know ovarian cancer can be linked to breast cancer as well. when there's a hereditary factor involved. So can prostate cancer, so can pancreatic cancer. Sorry, I was trying to see if I can get rid of this bar at the top here. And prostate and pancreatic cancer, there is a major lab in this country out in California. And I want to give you the scoop because they are offering no-cost genetic testing for all individuals with pancreatic cancer and almost all, but most men with prostate cancer who have something called intermediate to high risk prostate cancer. So again, we're going to drop in the chat links to that no-cost testing. The testing is no cost, but you still need to have a provider order the test. So again, talk to your provider, or you can refer yourself directly to a genetic counselor, and I'll give more information about that later. Because we can find, and it has happened, seen it time and time again, that we can figure out that there's a breast cancer susceptibility in the family from a relative who has pancreatic cancer who tested positive, or a relative, a man who had prostate cancer and tested positive. Also, just want to, again, give this message that sometimes gets lost, is that women can inherit a breast cancer susceptibility from their fathers. So it's important to look at that from the father side of the family too for cancers. And then just highlighting other cancers that have been associated with breast cancer. And that's renal cancer at the top there, and leukemia. So depending on the gene, there's several different genes related to cancer. These genes often are related to more than one cancer, not just breast cancer risk. So oftentimes people may not know their family history for various reasons. Their relatives are private, they're not sharing it. You may not know one side of your family or the other. People are adopted. So there's limitations to family history. And so, the medical community realized we were relying too heavily on that. And so there's criteria for just someone with breast cancer. So a breast cancer patient diagnosed under the age of 50, and they don't know their family history, they're eligible for genetic testing. If a woman has had two cancers, like in both breasts, which is called bilateral, with one of them being under the age of 50, if a woman is diagnosed under the age of 45, and you only have to meet one of these criteria to be eligible for testing. If a woman has triple negative breast cancer diagnosis, regardless of her age, she's eligible. Metastatic breast cancer patients, so cancer stage 4, that is another kind of new criteria for being eligible for testing. Because if you test positive for a mutation in particular genes, there's medications that can be offered that are FDA approved that have been found to work better in women with patients who have breast cancer and have a particular gene mutation. And then if you have a diagnosis of both breast and ovarian cancer, you're eligible. A man with breast cancer, because that's uncommon, they're eligible at any age. So these are sort of red flags to know if you haven't already been tested, you meet criteria for testing if you have any of these types of cancer, breast cancer. However, I will say that there was a professional expert group that got together, a surgical group, and they recommended genetic testing for all women with breast cancer, regardless of her age, regardless of what type of breast cancer. It hasn't really made it into the official guidelines that insurance companies follow. The ones listed here, most insurance companies do follow. But again, this panel of experts said all women should have it because they know that if we can identify those 5 to 10% who have a genetic factor, then there's that trickle down. We can find cancer earlier in their relatives. So ask your doctor, if you've been diagnosed with breast cancer, you're a survivor, you've never had genetic testing, talk to your provider and find out if you can get genetic testing, because there are some programs, some research studies, other ways that we can get testing covered if you don't meet insurance criteria. This is just a chart from a study of over 30,000 women with breast cancer who underwent genetic testing. And what they found was 9% of women. So if you think about 9% of 30,000, that's a lot of women. And if you think about all of the women diagnosed each year, if we can identify who has these genetic factors and then test their relatives who are at risk, we will help to greatly close the gap and reduce the burden of breast cancer in our society. BRCA1 and 2, you may have heard of them. They are the most common breast cancer genes. About half of women or men who have a genetic factor involved in their breast cancer will have a BRCA1 and 2 gene, but there's several other genes that are also related to breast cancer. It used to be we were only testing for BRCA1 and 2. That changed around 2013, and we started offering testing for other genes related to breast cancer. However, some providers are still just testing for BRCA1 and 2. So if you've had genetic testing, make sure to get a copy of your report, see what you were tested for. If you were only tested for BRCA1 and 2, you may be eligible for some additional genetic testing because this doesn't explain everything. Again, there's other genes that increase the risk for breast cancer. Again, just going to quickly go through other red flags for there possibly being a genetic link to your breast cancer. If you're diagnosed with triple negative breast cancer, we know that's more likely to be linked to the BRCA1 gene. Studies are finding other genes like BRIP1 and PALB2 are associated with triple negative breast cancer. Triple positive breast cancer is associated with the TP53 gene. Lobular breast cancer, most breast cancers are ductal. They're in the ducts here in this picture, these tubes. However, there is something called lobular. These are the lobules where breast cancer can develop. It's uncommon. If you have lobular breast cancer, you want to see about genetic testing because it's associated with the CDH1 gene. Men with breast cancer are more likely to have a mutation in BRCA2, but other genes also have been found associated with male breast cancer. Bilateral breast cancer, early onset, defined as less than age 50. They're associated with all types of breast cancer genes. So it's important to obtain a copy of your pathology report. I can't stress that enough. Keep it in your records because, first of all, you want to talk to your provider about it and see if you have a type of breast cancer that's associated with the hereditary factor. It's also something that you want to have in your possession, something that you want to share with your family as well. So we heard earlier the state of the breast cancer crisis in Black women, and the numbers are disheartening, but we should feel empowered to know that there's steps that we can do. We can put all of our energy and force into making changes, which is, one of the steps is doing that by being here at this town hall. So we heard, Black women are 42% more likely to die of breast cancer. So, how can genetic testing help that? Genetic testing can identify women who are at high risk for breast cancer. A genetic evaluation, even if testing is not offered or a woman tests negative, an unaffected woman can find out her risk to develop breast cancer in the future based on that breast cancer risk model, and there are others, but one of them we did provide a link to. And then high-risk women are eligible for more frequent screenings, and that was mentioned earlier by Dr. Newman. So mammograms, but also breast MRIs. So two different modalities, imaging, two different ways to image the breast. So what one imaging could miss, the other one maybe could pick up. So it's important to do both for women who are high risk. And then more frequent screening, not just once a year, but having screening with imaging twice a year. This can lead to early detection. We all know this, if you find breast cancer early, it's more treatable, there's more treatment options, and there's a lower death rate. So Black women under 35 get breast cancer at 2 times the rate of white women and die 3 times the rate. Okay, we heard that stat too. And what can we do about that? And when it comes to genetic testing, we know that if a young woman, a young unaffected woman, tests positive for a genetic factor, or if they have a family history, And they get a risk assessment, a risk evaluation, which can be done by a genetic counselor or other providers, or you can do it yourself, again, with that risk tool that was put in the chat. The women oftentimes, especially if they have test positive for a genetic mutation, can begin breast cancer screening as young as 25. Most 25-year-olds aren't thinking about breast cancer screening, but if they have a genetic risk factor, it's highly recommended they start at 25, because we know cancers can happen earlier if there's a genetic susceptibility. Also, again, if genetic testing doesn't explain everything, if there's that family history there, it was a question in the chat in the morning session, what age to begin? It's age 40 for women if they don't have a genetic risk factor that's been identified. However, it's younger if there's a family history, a close relative with breast cancer who was diagnosed. You want to look at the age that relative is diagnosed and then subtract 10 years. And that's typically when screening would begin, whichever comes earlier. Does 40 come earlier or subtracting 10 years from the relative's diagnosis? Risk reducing bilateral mastectomy. So women who are at high risk, if they have a BRCA1 or BRCA2 gene, or any of the other genes that have been mentioned, their risk can be anywhere between 25 to 80%, depending on the gene, highest for the BRCA1 and 2 genes. And so an option is to consider surgery. And I know for some that can sound drastic, but I know, Black women personally who have gene mutations and they've decided to take this option because, they had a mom or a sibling or close relative who also had the genetic factor to pass away from their cancer. And they wanted to do whatever they could to reduce their risk. So they had surgery, bilateral mastectomy. Some of you on this call may have had that surgery too. And reconstruction is always offered as an option and it's covered by insurance. So the other fact that was discussed earlier is that Black women have 2.3 times higher odds of being diagnosed with triple negative breast cancer, which is a more aggressive type of breast cancer. As I mentioned earlier, all women with triple negative breast cancer are eligible for genetic testing. So, I kind of laid out how genetic testing can help us to identify high-risk women to reduce their chances of getting cancer or to find it early. However, there's a genetic healthcare crisis in Black women. What studies have shown is that Black women are less likely to have awareness of genetic testing. Unfortunately, their providers are less likely to refer them than their white counterparts with similar family histories or personal histories, 16% less likely. So recently, I authored a paper where discussing how nurse practitioners, but that can be replaced with any providers, play a vital role in achieving health equity and referring all eligible women to genetic testing and men. And there's, several of my colleagues who are also trying to increase the awareness about this amongst us, amongst health providers, to make sure that we are referring patients equitably. There's also lower access to genetic testing services, unfortunately, which then leads to lower rates of genetic testing. Lower rates of genetic testing means that there's the labs that perform these genetic tests keep databases. So they're studying and trying to understand the variation within all populations. If less Black people are tested, they don't know as much about our genetic variation, if a variation is normal versus harmful. So that means we have higher rates of something called variants of uncertain significance. So we're taking a test and we're more likely to get a result that's uninformative, it's inconclusive results than a white woman. So same test, getting billed the same insurance, same cost sharing, and we may be getting a test that it's not as you can interpret it. If you have a variant of uncertain significance, if you've had genetic testing, another key thing I want to get across, the doctor or provider that ordered that test, make sure to contact them once a year, at least, to get an update on that variant, because they do eventually get reclassified. Black women also have a lower access to polygenic risk scores, PRS. And PRS is basically, it's not looking at one particular gene for a mutation. It's gathering several genetic factors that we can find in our genetic material to come up with a risk score to develop breast cancer. And so beginning in 2017, a lab called Myriad Genetics, they started offering polygenic risk scores, but only to white women. Unaffected white women who underwent genetic testing, they were negative for those major genes, but then they ran their polygenic risk scores. And so again, we were doing the same test and not getting the same quality of test. Myriad has recently said that going back to 2017, when they began offering the test, that they will now give women of other ethnicities, because they've got enough data now to offer it to women of all ethnicities. So if you're unaffected with breast cancer and you had genetic testing at Myriad in the last 5 years or so, go back to your provider and ask for your polygenic risk score. Those scores aren't really used clinically just yet, but they will be eventually, and you'll have that information. And you can start having conversations with your doctor about what this is showing about your risk and anything that you can possibly do about it now. So I'm just going to end with a call to action. And a lot of them were kind of embedded in what I was discussing, is to stay woke. You guys are doing that right now by being here, educating yourself, and then each one teach one. What you've learned today, go on and teach it to a loved one. Ask about and document your family history, which includes sharing your breast cancer diagnosis with your relatives so that they then know that they're at risk for breast cancer. Important to document it, but also to share that information with your providers so that if you're eligible for genetic testing or any other type of genetic evaluation, you can get that. You want to partner with your healthcare provider. You want to make sure you have a provider that's listening to you and it's really taking your concerns into account. As mentioned earlier by Dr. Newman and Dr. Mitchell, you can always get a second opinion or get another provider if you're not happy with the one that you have. Ask for updated genetic testing for those polygenic risk scores if you're unaffected and was tested at Myriad labs. Ask about your variants of uncertain significance if you received genetic testing and you had an uncertain result. Are there updates to that? And again, because the referrals from providers are unfortunately low, you can self-refer to genetic counselor. You can find us, one local to you, by going to this website. We also have a list of Black genetic counselors if you would feel more comfortable seeing a Black genetic counselor. And that's something that I'll make sure gets to Sisters Network to get to you all. And then consider joining a clinical trial or a study. The only way that we won't be left out like we were with the polygenic risk scores is if our DNA, again, our Black genes matter, if our DNA is represented in these databases. And the way that that happens is by getting genetic testing and also by joining studies. So all of us, again, you want to talk to your providers about the risk benefits of these studies because it's something that shouldn't be taken lightly. The All of Us research program out of National Institutes of Health is trying to build a database of 1 million Americans from all walks of life, from all ethnicities, so that they have a better understanding of the connection between genes and environment. The All of Us program is also returning results. So you will get information about any significant genetic finding. Thank you. Hope there's time for a couple of questions.
Thank you so much, Grace Ann. Genetic testing is so important. I did want to get one question in before the participants have to leave to go over to the other session. We have one participant who was diagnosed with breast cancer at 44, and her daughter will be 34 this year. Mm-hmm. And I know that she is going to start having her mammograms this year, but should they be yearly thereafter?
Mm-hmm. Yeah, so we do recommend that once you start that they are annual, and also consider having a breast breast MRI. From what she's saying, it's very likely her daughter is also eligible for breast MRIs, which can sometimes pick up abnormalities better than a mammogram because young women have dense breast tissue, and mammograms have been found to be more effective in older women who don't have this dense breast tissue. So she also is likely eligible for a breast MRI. Again, she should run that risk model on herself and talk to her doctor. It would then be annually that she would get screening.
Great. Thank you so much. We have time for one more question. Does insurance cover both the mammograms and MRI screenings, or only if you are diagnosed with breast cancer?
Right. So that's a great question. So insurance companies, every insurance is different, so I can't speak for all of them, but it is part of the standard clinical guidelines that most insurance companies follow, that it should be covered if you're high risk, meaning 20% risk or higher, based on that risk model that is in the chat, or testing positive for gene mutation, or family history, other family history factors, that it should be covered, the mammogram and the breast MRI annually. But there's exceptions, but in general, it should be.
Great. Thank you so much for the free links that were placed in the chat. So I hope everyone had an opportunity to jot those down. Thank you for the wonderful information that you've shared with us this morning. We will now allow for the participants to move to another session. Again, thank you to all the participants for logging in to this session. And Grace Ann Fasaye, thank you.
Oh, thank you for having me. It's always my pleasure to
You are so
be
welcome.
part of the Sisters Network family to give a talk. Thank you.
Yes, thank you so much for all the information that you always share with us. It's always wonderful. Thank you. Have a great day.
All
Enjoy
right,
the
you
other
too.
sessions. Thank you.
Okay, thank you.
Bye-bye.